Hi, I'm Dr. Sharon Colasso Dias. I am a prosthodontist and implantologist. I have been a dentist for the last 30 years, graduated from Nair Hospital, Bombay. I've been in Bangalore for the last 20 years, where I have been at Manipal Hospital, the main one on Airport Road. I'm currently the head there. This is my private practice, which I have since the last 8 years. I would say it's a modern practice, and we try and get better at what we do every day. I mean, that's our aim. We have tried to bring in a lot of digital. So we have been using an intraoral scanner for a long time. And most of our impressions and our implant impressions, or I should say measurements, are digital. My emphasis is on implantology. That is what I have been doing for the last 15 years. I have a team of about 12 dentists working with me in this practice. I like to have lady dentists. I like to empower women. So we have a woman-based practice. Our men are only the assistants and reception. All the dentists here are women. And we have a great atmosphere where we are constantly learning, and I love to teach, so that gives me a great high. I'm always, feel good teaching and empowering the young dentists. What more should I say?
Other consultants are made.
Sorry?
Other than few consultants are made.
Okay.
She believes in our
Sure.
Indian Nari Shakti.
Sure. Yeah. So.
You can just take one
Yeah.
of this room.
Yeah, so this is our very untidy room where we
Not
actually
untidy, it's a tidy place.
cluster together, and we have our team meetings, and we decide what has to be done on which patient, and go through our previous patients and do some amount of talking about our cases. We keep our implants and all our, our abutments, and everything that's important lies in this room. This is actually my personal room, but we all use it. So this is, we start from the end. This is a small laboratory which we use to, like everyone else. This is a room that has been kept for our CBCT machine, which has yet to come. So we'll start from the end of the clinic to the beginning. This is the last chair. We have 5 of these chairs. They are Castellini chairs, completely digital, great to use. Everything, we key in everything. All things can be keyed in, and make sure that every chair has a screen with something soothing and calming in front of the patient to distract the patient. This door leads to the CBCT room, which is just yet to come, but everything is wired and ready for it. There's a small lab here for our models and mixing of plaster and stuff like that. Then we will go back to the next chair. So, I mean, they're all identical. The spaces are also identical for the chairs. 2, 3, 4. We use this often for pediatrics. It's a closed room. So, I mean, children need some privacy, and sometimes we turn on the cartoons for them, so they are okay. This is our intraoral scanner. It's a 3 shape that we have. And this is the room that I use for implants, actually. So this is my personal room where I do most of the implant dentistry. I can take you out to. This is the waiting area, the main waiting area for the clinic. Yeah. Yeah, so this is the outdoor lounge that we have. where our patients can wait for their appointed time for their appointments. Actually, we developed this during the time of COVID, when people were very concerned about sitting in indoor spaces. 2001, 2, people didn't want to sit in a waiting room at all. So we had these areas, done so that they could sit outside and wait. So many of our patients, they bring their parents for treatment. Then they sit here and work on their laptop for hours on end. They don't have any problem. There's good internet. So they are very happy to sit here. And if you tell them procedure is going to take 2 hours, they're okay with it, 3 hours. This is software city. So everyone's working on a laptop. Yeah, so I'll just run you to in. Oh, actually, I can show you the other part of the clinic, which was my first clinic, which has 3 chairs, and now we are pretty much using it for pediatric dentistry. So I can take you there. Yeah, so this is the second part of my clinic, which is actually the first part. This is where we started, and this is a 3-chair clinic. Now it is used mostly for pediatric dentistry and sometimes ortho. Or if we have excess patients, we take them here. It's completely functional, but we are spoilt with that side, so we don't feel like coming here. So this is the clinic which has the OPG machine, and which you already took a picture of, I think. Yeah, so it's a Atique. We've had this for 8 years and it works well. This is our lab, second lab. This is where all our autoclaving goes on, sterilization and autoclave. Yeah, so happens here. And
so now you are using this part for pediatric patient.
Pediatric. And general maintenance and everything, generally to get autoclaving and all happens here.
Mm-hmm.
So
Centralized autoclave.
yeah, and this side we have a desk, so we have sometimes if we want to, talk to a patient, then we turn on the laptop or the computer and give them a treatment plan on this. So
Wonderful. Really wonderful.
thank you.
I love this concept.
The outdoor place, the outdoor space. We have one more outdoor space.
We have outdoor space, one more.
Yeah. So this is the other outdoor space where actually our patients get to have coffee and we spend some time.
Like a restaurant, like the
People, patient who can have sit and have coffee. Or when I come over, we have a coffee.
Yes. So it's
that's how
a
it is.
nice place to just
Actually, it is connected also.
Yeah.
You can go through that.
through this.
It's
Yeah.
a huge place.
Yeah.
It's a total of about 5,000 square feet,
Okay.
and it has 8 chairs total. I could actually fit in a lot more chairs, but I want this feeling of space and a feeling where it's not cramped.
That's what
Yeah.
I would like to
Yeah.
ask you.
Yeah.
If anyone finds 5,000 square feet, then he might set up
16 chairs. Yeah.
But you have just confined it with 8 chairs and a free space. which
Because
is
I
an
feel
excellent
we
idea.
actually honestly don't need more than that. Because if you are not running a bulk practice, you're running a practice which is a quality practice, then you cannot have more than 8 people at a time. You cannot service more than 8 people at a time. So if you're doing that, then this is more than enough. I mean, we're open from 9:30 in the morning till 8 p.m. every day, Monday to Sunday. So every day of the week, including holidays, including Diwali, Dasera, Christmas, Good Friday, everything. So I don't think we really need more than this much space. And every patient is made to feel important. Like, they have a space of their own. They have a TV to watch. They have enough, about 2 to 3 people taking care of them. So that's the whole idea.
becomes more of a dental spa. I would tell. Isn't it?
No, we have those kind of
That's
patients.
patients, yeah,
We
I
have
know.
patients who you see in the newspapers who are,
She has a very high clientele.
yeah.
Actually.
So
It's, top of the Bangalore crowd. She
mostly
has
industrialists and
clientele. Ministers.
yeah, so people like that. So I mean, I feel this kind of space is required. So
Wonderful. Thank you so much.
wonderful, lovely talking to you.
Thank you so
Thank you.
much.
Thank you.